Hello, my name is Meredith Smith, and I'm a nurse practitioner at Michigan Medicine. I'm presenting a case presentation on IV sotalol, a new twist on an old drug. Sotalol is used for its class 3 potassium channel blockade antiarrhythmic properties for both atrial and ventricular arrhythmia management. Admissions for oral sotalol initiation have historically required a 3 or 4-day hospitalization. These patients have been housed on an inpatient unit at Michigan Medicine. With updated FDA recommendations, however, patients can receive one intravenous sotalol dose followed by a transition to oral sotalol, shortening their admission to an overnight stay. Benefits of using IV sotalol in this regard have been established, including reducing the expenditure of time and resources, reducing costs to the healthcare system, and reducing potential exposure of patients to nosocomial infections. We enacted a new process for patients to be admitted for sotalol initiation. Patients are admitted to our cardiac procedures unit observation area and receive baseline laboratory studies including basic metabolic panel and magnesium level, along with an EKG. Patients presenting an atrial arrhythmia undergo a transesophageal echocardiogram to rule out left atrial appendage thrombus. Based on the patient's creatinine clearance, he or she will receive a certain dose of IV sotalol given as a 1-hour infusion with assessment of QT and QTC interval every 15 minutes during the infusion. Again, depending on creatinine clearance, he or she will receive either 1 or 2 oral doses of sotalol afterwards at the specified time frame, with an EKG 2 hours after each dose for QT and QTC assessment. Should the patient remain in atrial arrhythmia, he or she will undergo cardioversion prior to discharge. A patient's sotalol load is considered failed if his or her QTC interval prolongs greater than 500 milliseconds or 550 milliseconds if ventricularly paced or in the presence of a bundle branch block, or if the QTC increases 20% from baseline. In this case, a lower goal dose of PO sotalol can be considered, or sotalol can be discontinued altogether. We have had 7 IV sotalol admissions. 6 were successful at initiation onto oral sotalol via the initial IV infusion, while 1 admission was considered failed due to QT prolongation after the IV infusion. 5 additional patients were canceled prior to admission due to various reasons: left atrial thrombus on pre-admission TEE, baseline QT interval prolongation, significant bradycardia, presence of heart transplant requiring admission to a different service, and active heart failure. The patient's length of stay in days was calculated for quality improvement purposes, which was then compared back to the length of stay in days for our oral sotalol initiation admissions during the same time period. The average length of stay for our successful IV sotalol admissions has been 1.12 days, whereas the average length of stay for our oral sotalol initiation admissions during the same time period was 2.88 days. With our new process, we have reduced length of stay by 61%. Additionally, by transitioning these patient admissions to our cardiac procedures unit observation area, we allow better bed utilization of the now available inpatient beds. In alignment with updated FDA recommendations, this new sotalol initiation admission process allows patients to be initiated on sotalol therapy using a single IV dose followed by a transition to oral dosing. This approach shows promise for positive benefits to our patients and our healthcare system.